Good day. I am Dr. Wilfredo S. Tagle, urologist, and welcome to Medical PracTIPS. It is a series of tips and tricks to help you start your medical practice. Today's episode will be the beginning of our new series on starting your year right because it is New Year. In starting this year's right, you start with yourself. Your most important investment is yourself. So you need to take care of your health. Like they say, a healthy body is a healthy mind. This can be achieved by having an executive medical checkup. The purpose of the annual checkup includes the following. Number one is to prevent illnesses. This is to prevent any sickness that may come to you for the next years to come. Number two is to discover new illnesses. As you know, there are a lot of sickness which may be or is starting. You may be asymptomatic, but there are starting sickness that you cannot sense or it is asymptomatic. And lastly, number three is to control an existing illness which you've been dealing with for the last few days, months, and years. Okay, as you know, checkups are not limited to a specific group of people. It is recommended whether you are healthy or sick, symptomatic or asymptomatic. Usually, we are busy, but even if you're not busy, you really have to have that annual medical checkup. The examinations should be done based on your age and not with what you feel. Usually, if you're young enough, below 40, the basic annual examinations will suffice. That means your blood works, chest x-ray, urine analysis, and so forth. But if you're above 40 years old, which needs a cardiopulmonary clearance, you have to have an evaluation of your heart for cardiac evaluation. Number two, pulmonary evaluation. Number three, endocrine. You might have diabetes or some thyroid problems, metabolic problems. Fourth is your genitourinary evaluation. If you are a male, specifically your prostate. Okay, for 40 years old and above, it's very important to evaluate your prostate and your erectile dysfunction. If you are female, on the other hand, of course, we have to evaluate your gynecologic problems. Then, you also have to evaluate and visit your neurologist. And lastly, take care of the big C, cancers. Still the number one cause of problems and mortality for doctors are cancers. Okay? So you have to have a cancer panel checkup. The annual medical exams are not only for your patients, but for doctors as well. Remember, sometimes the worst patients are the doctors itself. They tend to neglect what are they feeling because they are very busy and toxic to their patients. So let's do it right and do it now. Get your annual examinations right now. So that's it for today's episode. Like, follow, and subscribe to your Facebook and YouTube page to catch the latest episode of Medical PracTIPS every Wednesday, 7 p.m. Please share this episode of Medical PracTIPS so we can help you more young spirit doctors build their practice and better serve their patients. Okay? See you. Bye-bye.